Okay, showing the workspace first. I've got my table, the list of items to be identified, the heart sitting out there. Nothing else around for me to use. Okay, set this back up. And hopefully this goes in a single take, we'll see. All right, so first off, we have got our heart here. The aorta, first thing to be identified, is this structure coming off of the heart with the opening right here. If we open it up and go inside, we'll be able to see the aortic valve, the aortic semilunar valve as we come through and see where this is coming out. The aortic semilunar valve is right in there. Next to it, you can see one of the flaps right there where my finger is. All right, close it back up. The apex is the point of the heart down here at the bottom. The atria, if we come around, the right atrium is going to be here on the top posterior aspect of the heart. The left atria will be over here. If we open it up inside, the right atria is way up in the top back. The left atria is way up here. The auricles are these flaps that are associated with the atria, right, left. The base of the heart is this flatter upper aspect of it, up top. The brachiocephalic artery coming off of the aorta is where it's coming out on this side over here, where it would branch off to go away from the aortic arch. Right there. Not really attached, not really a point that can be seen coming up and off how they've cut this one. The chordae tendineae down on the inside are these stringy, sinuous flaps that are pieces that you can see. The endocardium, actually that's a good view right there, the shiny, slick surface on the inside, really visible on the inside of the left ventricle there. The epicardium is this coating layer on the outside of the heart muscle itself. The inferior vena cava, there's not really one attached to this, but it would be, according to the video, they cut them off a lot of times or when they're prepared, but it would be coming in and inserting into the right atrium. The intraventricular septum is this large bit of the muscle right here. The intraventricular sulcus, you've got it on the outside, showing down the anterior aspect of the heart, the right and the left, and on the back side, the right and the left. The mitral, or the bicuspid valve, is going to be between the left atrium and ventricle. It's going to be up in there. Okay, so you can see where we're coming through. If we look deep up in there, trying to get some light on it. There it is, the shiny connective tissue up in there where this is poking through. That's going to be your bicuspid valve between your left atrium and left ventricle. The myocardium is all the generalized musculature of the heart, including all the walls around, the septum in between. You can see it on the anterior aspect that's peeled away as well. The papillary muscles are these little guys right here, these little muscles that are holding the chordae tendineae in place. The pulmonary artery we're going to kind of have to do this one together with the pulmonary trunk. Coming out of the pulmonary trunk, the pulmonary artery would branch off. It would go to the right and to the left, but they have been cut away. So we have just the pulmonary trunk here that it is in. The pulmonary valve, if we go ahead and push all the way through, you can see I've had to peel the right ventricle open a little bit more, but the pulmonary valve, pulmonary semilunar, is coming out of the right ventricle around on either side of the dropper there. The pulmonary veins, which would return to the heart, would come in through the back here to the left atrium. They are not on here as individual pieces, but they would be coming and delivering oxygenated blood to the left atrium on that side right there. The superior vena cava, we've already kind of touched on this with the lack of the inferior vena cava, would be inserting into the right atrium right through here on the top. The tricuspid valve, if we keep pushing through there, we will see where the right atrium goes into the right ventricle. In there, the tricuspid valve would be the valve between the two. And then finally we have our right and left ventricles. The right ventricle is where we just were, over here on this side, this larger space on the right side of the heart. The left ventricle would be all of this opening on the left side of the heart with the larger musculature around it.